Good afternoon, everyone. I hope you are had a good lunch and you are feeling a little, at least full, if not caffeinated as well. We are very excited today to have the LeRoy Health Policy Lecture, which is named for GIH's second president, Lauren, who is here with us today. And it's an opportunity to have a really rich conversation with a leader in the field of health policy. And I'm super excited about our guest for today. I'm going to ask a couple of questions of her, and then I'm going to turn it over to you guys because I know you have a lot that you want to hear from her about. And talking about the breadth of health and public health, we are going to be joined by Dr. Keshia Pollack Porter, who just became the 12th Dean of Johns Hopkins Bloomberg School of Public Health on August 1st. So she leads over 900 faculty, 1,400 staff, and 3,100 students from 88 nations at a university that is the School of Public Health that is over 100 years old. She's an internationally recognized scholar and expert in advancing policy change for safe and healthy environments, and she's published more than 200 peer-reviewed articles and was elected to the National Academy of Medicine in 2023. You have her full bio in the app, and so I invite Dean Pollack Porter to join me on stage. So, we got Paige Joe. Okay, so welcome to Grantmakers in Health, to our Health Policy Exchange. You are a new dean, and what I didn't say, but we're going to talk a little bit about, the second woman, the first Black dean at the School of Public Health. So this is historic. Tell us a little bit about that.
Yeah, thank you. Well, first of all, I'm thrilled to be here. Lauren, I'm honored to be here in your honor, and thank you so much. I am a little in awe sometimes when I think, oh, wow, I'm the person at the top of that org chart, just to be honest. I am honored and humbled to be Dean of the School of Public Health, and I really believe in calling and purpose. And my grandmother always said to me, you were here, created for a reason and for a reason, and do something to find your purpose. And leadership has been a part of my story, and I felt called to put my name in to go through this international selection process to be dean of the school. At this moment, it was confirmed in my mind after the election that I needed to apply at this moment. And I've been first before. I was the first Black chair at the school, which is crazy to say. I became chair in 2022, a department chair. And so to be the first dean of color, Black dean, and only the second woman, I was telling Kara earlier, if you go into the dean's boardroom, there's photos of all the deans, and they're all Black and white. And so it's male physician, white male physician from 1916 through to our first female dean, who was also the first non-MD to be dean. And then me. And I was telling my communications person we should think about whether or not if that should be the first color image on the wall and not a Black and white image.
So, in this moment, we've been talking about the attacks that are happening in our country, how they are, not so veiled in some of the racism and xenophobia. And you are a woman of color leading a very large and prestigious organization. What does that mean personally?
Yeah, I acknowledge there are people who were not happy I was selected to be dean, straight up. And there were vile things said online and all the things that I don't pay attention to. Those are distractions. Yep. Distractions from my purpose, from the mission, the things I'm called to do and to lean in at this moment. And because of my passion for health equity, for policy, I am even more firm in my commitment to make sure that we stay focused on mission during this time. But it's hard. It's hard. And there are people in my circle who care about my safety and who are concerned for those things. And certainly I'm in the role with eyes wide open and reminding myself that I need to stay focused on leading this school through this difficult moment for public health, and leaning into hope and choosing hope over despair. And that is a place I choose to live every day.
Yeah. Yeah, and we're going to talk about, you touched on all three things, kind of want to go, and so I'm going to take them a little bit in order, but let's talk about you. You are a health equity scholar. And we just had a conversation about, what words are we using? How do we stick to our values in that space and talk about that? So what does it mean to be doing that work as a health equity scholar in this moment where we've seen so many federal cuts, especially to academic institutions who were having grants around health equity and diversity, equity, inclusion?
Yeah, it's incredibly difficult. And I will say this, I'll answer this question from two perspectives. First is as somebody who has gotten grants. Very early on, I had a report that was on the verge of coming out. We submitted it, and then we were told we couldn't release it because it's on structural racism with federal funds. So when my faculty would say stories, they'd say, "Me too. I also am struggling here." We tried to figure out, is there a legal remedy? But there was always some little line in the contract that talked about how we couldn't release something. And it's hard. It's really hard because it's about the work and the communities that we worked with. That particular project, we spent time in communities across the country, engaging with communities, collecting stories as part of the data, and we couldn't share it publicly. I mean, that just hurt my heart to think about how the importance of talking about structural racism and barriers, we could not tell that story publicly. And what we did is we encouraged strongly other ways to tell that story and to get those stories out. The other way I answer the question is as an academic leader. When I was department chair, I hired a lot of people who do work in all the areas that no longer have federal funding. And I feel personally responsible for some of those people and thinking through, how do we pivot? How do we find other opportunities? And I look at this room and absolutely know that philanthropy cannot fill that gap, right? That's not possible. But how can we find other opportunities for people to connect with organizations or donors who are values aligned to support the mission of the work? But it is incredibly difficult. And I think about our newer faculty who are afraid about their career, who had a vision for how things would go, and that's just not the way things are now. And the impacts are uneven, right? There are some people who have continued to get federal funding are doing really well. But if you do work in structural racism, LGBTQIA+, DEI, capacity building, in under-resourced communities, it's just harder to get federal funds for that work.
Mm-hmm. So, talk to us about the faculty. You're sort of touching on some of those, so the uneven impacts. What is the situation at Hopkins?
Yeah, so Hopkins was, and it's interesting, people say to me, "Oh, you're not getting hit like other institutions." And I remind people that Hopkins was actually the first institution to get hit. All of the USAID money, we lost $850 million with those cuts. About 2,000 people worldwide lost their jobs, including a large number in Baltimore area. And that was early on in the spring, and it was so abrupt, and people were just hurt and confused. And I talked to people who had partners on ground in countries who were told, "You have to stop this work, this life-saving work." And I think where I am now, and where people are when I speak with them, are asking themselves, how do we stay focused? Because we haven't solved the problems.
Right.
We have not solved the problems. And quite frankly, when we see these impacts, or we see how a community where there was efforts to focus on contraception, for example. I just came back, my first international conference as dean was to the International Conference on Family Planning. I'd never gone to that conference. It was amazing. If anybody was in the room, I mean, Bogota was great, but the conference was great too. But it was one thing that was so powerful is there were so many people there who were doing things on the ground, like trying to get contraception to girls and women who lost their funding and are still focused on the work because they know it's life-saving.
Mm-hmm.
They know that giving women choices to access to family planning and choices over their body and autonomy saves lives, improves their lives, improves whole communities.
Mm-hmm.
And I left that meeting feeling so inspired and looking to see how people are just doing the work without even resources and trying to figure out how to scrape and find everything they can, because it is so critical. And to see that was really inspirational. And I'm reminded of how people's funds were just sort of pulled out from underneath them, and they're still trying to figure out a way to develop new partnerships. And it's about partnerships, it's about reaching out, it's about finding organizations that are, again, values aligned, and can support the mission of advancing health.
Mhm. And so, as you mentioned, that was in the spring. So, inquiring minds want to know, did you rethink taking the job? Shit, I guess.
Somebody said to me, they said, in maybe my first week, I was doing a seminar with some students, and they were like, "Do you feel like you were kind of lied to?" you know, I applied for the job in December,
Mhm.
and then went through the process, and and multiple rounds of interviews, every round, like things got worse and worse. And at one point, I was like, "What am I doing?" But seriously, I truly believe in calling and mission, and I felt like this is the time. This is the time for the leadership and the perspectives that I can bring to the table. And I said that with deep humility, but just naming that, I felt like I'm the right person to be doing this at this moment. And I meet people and they say to me, "Oh, congratulations on being dean. Let me offer you condolences." And I recently said to somebody, I said, "Don't, no condolences. No, I could have said no when the president offered me this job. But I knew that this was the time for me to step into this role. I love public health. I love the field, and I know that there will be another side of this. And to be able to help us think through how do we thrive through this moment, not just survive, is something that fuels me."
Yeah. No, well, first of all, we are so glad you did say yes. Thank you.
Thank you.
And let's talk about that. So you just had your first column published about a month ago where you're talking about public health in hard times. So what is public health looking like right now? And what are your thoughts about how we navigate through this moment?
Yeah, it is a volatile time for the field. I'm talking to young people who are even asking themselves, should I get a degree in public health now?
Yeah.
Right? They're saying, like, maybe I don't know if I'll have a job. I shouldn't go to grad school. People are saying, let's just wait on the sidelines for a few years.
Mhm.
I think those are incredibly harmful strategies. And part of what we're trying to figure out now is how do we stay focused on mission and hold on to our values. At the core of public health is social justice and equity. How can we have a field where we don't talk about those things? Or how can we have public health without global health? I mean, these are so central to what we do. I think our strategies have to change a little bit. For example, as a health equity scholar, I do work in communities, and I was early on, and as things started to get challenging for those of us in the space, I remember talking to a partner, and we were both angry, and she said to me, "Keshia, don't fight on the words, fight on the work. Like, if we can't say the words, fine, but let's stay focused on the work." And I acknowledge that not everybody supports that perspective. Like, I acknowledge that. And I have friends who are like, no, we gotta fight the words. But hearing somebody in the community say, if we don't use these words and we can still get the resources that we need, we're okay with that. And there will be a time where we can use the words again. But how do we maintain the momentum and the work that we've been doing? So I think those are a few things. The other thing I'll say is I think this is a tremendous opportunity to think about how we build forward. How do we reimagine? Because part of what I've seen is what's been, I think, so jarring to people is how easily it feels like public health was dismantled in this moment. Like, where was the coalition? Where was the foundation saying, and the people saying, wait a second? And we didn't have that. And so I think as we look ahead, a question that I'm asking is, if these attacks happen again, how do we actually withstand them in the future? How do we fight back against them? And how do we reimagine a world where people who felt like the system, or who experienced the system not working well for them before, can have the system working better for them in the future? So I'm looking forward to and continuing to imagine and dream and say, what's the vision for the future? And I think that's where we are right now in public health. And that has to be engaging differently, showing up and admitting when we're wrong, embracing humility. Like, all of those things, I think, are critical.
Yeah, no, it's interesting you say that. I think that, and I want to ask you, like, why don't you think there was a coalition? But I think it's been a theme that we've heard throughout the conference, and we've seen in so many spaces that so many programs weren't working well for many people, and were easily able to be dismantled or taken down. And so, how do we build that coalition? But for public health has been around for a minute. It's not a new field. Why don't you think there was a coalition?
I wish I had that clear answer. I think it's complicated. I would say one thing is people are still really angry about COVID.
Yes.
People are still really angry about COVID. And even a couple of weeks ago, I was talking to somebody who was saying, like, you closed my kid's school. Like you closed the daycare, or the gym was open, but my kids couldn't go to school. Right? I mean, people are really angry still about this, and they don't believe public health. I think, where the voices, the trusted voices, the scientists, people are not trusting them anymore. So I think all of that anger, which is still incredibly present today, is part of, I think, part of the reason why we didn't see people stand up and say, "Hey, wait a second." So that's one thing. I also know that in certain parts of this country, public health as a phrase is very triggering. It also closes doors. I've talked to people who call me and say, I'm working in X conservative state where I can't even talk about public health. How do we think about public health differently, and helping people understand the value? And because public health, I remember, is doing a project in a rural community in this country, in the country, and talking to somebody, and they were saying, like, I don't understand public health. And I said, well, the clean water you're drinking, or the air you're able to breathe, like, how do we even talk about this? And I think we haven't always talked about it in a way that resonates with people. So I think that's another part of it. And finally, I would say we're really fragmented as a field. Everybody has their little area. And even when I think about our public health organizations, it's only a small part of the public health field. Everybody doesn't feel represented by those organizations. So I think all of those things together are the things I've been reflecting on.
Yeah, it is. It's very interesting, sort of, when we think about, today is National Rural Health Day, and if you've seen one rural community, you've seen one rural community, and public health in rural communities is very different, and so it is challenging. We were talking just before this about, how does one explain public health succinctly in a way that resonates with the public? Because we've got the 10 essential functions that. So I think it is a thing for us to figure out and navigate through. Before we get to sort of the radically reimagining the future, which I think is the opportunity and gives people hope, I sort of say it also helps us play more strategic defense, because if we know where we're going, we know how to organize and how to help support ourselves. But you are dean and you have some students, and you talked a little bit about people who are considering or rethinking going into the field. What would be your advice for prospective students or people who are contemplating, and even those who are thinking, oh gosh, I'm graduating in a little bit, and what am I going to do?
Yeah, I have been telling people a few things. One is, we need you now more than ever. That's my message. That's the first thing. The second thing is, I hear you on how challenging and difficult and scary this moment is now. And what we need students to do is also reimagine what their future looks like. So I've talked to many students who said, I always thought I was going to work at the CDC. Like, that was my dream. And now the group that I thought I would work at, there's one person and they're not hiring. Okay, I hear you. And let's think about the fact that public health is also local. Public health is also at state level. There are also other organizations that you can bring your public health skills to. And so helping people sort of think broadly about what that future can look like and where they can make an impact. I mean, that's one thing I love about public health students. They are all about making an impact and making a difference, and helping people see that there are so many ways to do that. And it doesn't only have to be the federal government. That being said, I do know there are people who are in the federal government. We need them too, right? And so thinking through, where can you find a place where you are, where that aligns with your values and where you feel like you can make an impact. And that's been the second message I've been telling the students. And the third message is, we will get to the other side of this difficult season. Storms always end. And let's think about how we can be part of that reimagining, that building forward, helping to imagine a world where we can achieve the health goals that we have. So a lot of what I do is speaking about hope. I tell people I live in a place of pragmatic hope. I mean, I know all the challenges. I know the grants being cut. And how do we remind people that the work they do is so critical?
And so for you, when you are moving on to your next phase of your career, or going off and enjoying your second retirement or something like that, what do you want your legacy to be at Hopkins?
Love this. I wasn't ready for that question.
Sorry.
I love this. I love this. You know, I have been thinking about this. You know, I finished my first 90 days, and I gave a presentation a little while ago, just kind of reflecting on what I've been doing my first 90 days and where I'm going next. What I would love to see when I look back on my leadership is for people to say, Keshia, as a dean, helped us thrive through this incredibly difficult season for public health and for the school. In the face of cuts to grants, in the face of visa issues where students can't even get here when they want to study, and the fact that the federal government doesn't think public health just is a profession that warrants grant funding and loans, right? Like, you know, for anybody who's not tracking that, public health and nursing are on the sidelines. And so when thinking through all of these barriers, all of these headwinds, knowing the impacts that it's having on our community, that people are losing their positions, what I would love for people to say is that, yes, in spite of all of those things, under Keshia's leadership, we still thrived. We thrived. We made a difference. We still kept focused on mission. We made a difference in communities, with communities. And I would love for people to reflect and for that to be part of my time. My initial term is 6 years. When I received the job, the president was always saying, "Oh, and in 5 years we'll work on your second term." I said, "Hold on a second. Let's go ahead and get to the first term." So I'm reflecting on where do I want us to be at the end of these next 5 years, especially, and again, lots of opportunities.
Mhm.
I'll say one other thing. When I think about what we've seen in change of federal funding, there were many institutions, and I will say this wasn't written down, where faculty felt like you needed an NIH grant in order to get promoted and get tenure.
Correct.
That no longer can be the bar.
Yep.
We have to change the system and the policies and processes internally. What if we had a system where tenure was actually based on impact? Surprise, right? Like, those are the kinds of processes and policies that I'm encouraging us to think about. And I say that as a tenured professor. I got tenured in the system. Like, I know what it means to write papers, but I also know that writing a paper for the sake of a paper isn't going to change lives, right? And so it's always like, how do we think about impact? And so I'm thinking through, how do we change the system internally? Because it's going to need to change.
Yeah, no, that is so great. I think about, coming through, and we sort of did graduate school around the same time and kind of coming out, and it's like, yeah, okay, what that means. And as someone who's doing health equity research, that funding wasn't as plentiful as it was in the last 5 years, but how that kind of moves forward, what that impact is, and getting those grants.
Okay.
So I want to pivot a little bit, because we've talked a lot about, community in this moment. You are at an institution situated in a very interesting and sometimes challenging community. You're at an institution that hasn't always had a great reputation of working with that community. So how are you approaching community in your tenure?
Yeah, community is critical. So we're in Baltimore. If you haven't come to Baltimore, come visit us in East Baltimore in particular.
Yeah.
And one is
June, our annual conference.
In June, annual conference, come to Baltimore, come visit. We have really good crab cakes. One of the things I think is so critical, part of my onboarding has been meeting with a lot of people. And as a policy person, I met with our team, and I said, I want to meet with every single elected official who touches our community, local, state, federal. And so I've done some Hill visits. I know some of you all did visits earlier this week. I think Hill visits are great to embrace our opportunity to engage with policymakers. And then I'm doing that now at the local level. Like, I had met some folks before, but to meet them as dean, and also people in the East Baltimore community. Who are the community leaders? Because people should know me. They should know me. And I think it's important that they know who I am. I took photos, like, when I became dean, and we took some outside and right outside in East Baltimore in front of the row homes, and somebody came over. They're like, "What are you doing?" I'm like, "Oh, I'm the new dean." They're like, "What? Hopkins has a black dean?" I said, "Yes, Hopkins has a black dean," And so how do we lean into that? And so it's been fun. And so to tell people, yeah, we're going to go ahead and connect with folks and just let people know who I am and why we're here working together. One thing I'll say is, before I stepped in as dean, they're building a extra piece on our building. And one of the things that I'm really excited about with our new space is that the first ground, there's a community space for community. to come in and gather. One of the things that we heard is so many community organizations don't have spaces to gather for free, right? And so thinking through how do we do that and having space where people can come in and we can actually co-create, co-share, be in the space together, and think about what do we do together to help improve the community's health. That's our responsibility to the city overall, and especially East Baltimore where we're located.
Yeah. And so on the previous panel, Matt was talking about some of the things that he had heard from his community when he started his position. And so as you were going out and talking to people, what did they say other than Hopkins has a
Yeah,
best
yeah.
game? Which is great.
It's Baltimore is a place that people will ask you where you went to school, and that means where you went to high school. And so people would say, "Oh, this is great. Where'd you go to school?" And I'm like, in New York, Deer Park." And they're like, "Where'd you go to high school?" I was like, "Not here." They're like, "Oh, you're not from here, right?" So that's the first thing. Where do you go to school? And the second thing that I get asked is, "Do you root for the Ravens?" Literally. And I don't, and I tell them no. I'm a New Yorker. I root for the Giants, and I'm very clear on that too. And so I think, but it allows people to engage in a way that they might not have thought. But and then I also people ask, if they can come see me, and I absolutely. And people do come visit, and sometimes we'll meet outside. I say, "Timely, if you want to come in the building, and we'll meet." Or if we want to go sit somewhere and get coffee and just get to know each other. So it's really been what sports teams are you, where you went to high school, and can I come see you just to hear what you're talking about? But I think my position at this moment has created an opening, which I'm really excited about. And it's been fun to meet people and to hear from them and to also acknowledge the harm that people have felt from the tension between Hopkins and East Baltimore communities and development and gentrification and all of these clear issues that we've had, and how can we repair that relationship? I mean, I can't do it on my own, but I can help.
Yeah, no, that is great. So I'm going to open it up in a minute or so for some questions, but I want to, let's radically reimagine that future. And as you're thinking about that future for public health and health, what does that vision look like for you?
Yeah. So my policy work is in an area called health and all policies, and I spend a lot of time with policymakers in other non-health sectors. So transportation, housing, energy, helping them think about the decisions they're making and how those decisions can advance health and not harm health. How they can advance health equity, not harm health equity. So I've created some tools to do that. I would love for us to be in a place as a world where we are thinking about how these decisions in these other sectors that affect the social determinants of health essentially can be made in ways that not only achieve those sector goals, but also don't harm communities. Like that's like my big vision for public health. And I'm excited to continue the work that we're doing to get there. And we have tools, and we're doing a policy analysis and sharing these findings with policymakers to help them make better decisions. So when I think about policy, that's what I'd love to see. I'd also love to see a public who actually understands public health and cares about health and is willing to stand up for public health. And part of that involves us as public health professionals engaging with people, getting out there in community and listening. And it's okay if we disagree, but actually listening to understand why somebody feels the way that they do. And it's really hard, especially when somebody's telling me that vaccines are harmful, telling me things that are just not grounded in data or evidence or science. And I'm trying to understand and at least listen. And again, there's I can't go in thinking I need to change your opinion, but really trying to understand, because that will help us be better ambassadors in the future and build trust with communities. And so I think that that's the other part. The final thing I'll say is I've been asking people when I interact with them and my students to imagine what it means to have a safe community. What does that look like? Or a safe school? Or what's your vision for a school that's health promoting? And I acknowledge it's really hard for people to imagine a world that they've never seen, right? And so starting there and saying, well, just think about it. What would it mean to be able to access grocery stores and afford the food in there? To walk safely and not feel that you're at risk of experiencing gun violence? To go to school and not have to go through metal detectors, right? All of these things, and this is what I'm helping people imagine. Like, what could that look like, and how do we get there? And that's the exciting part, because I do think it's possible. I would not be dean of the School of Public Health if I didn't think we could achieve a world, get to a place of a world that's healthy and safe for people, and where health equity is a thing. And I'm very intentional about health equity. I say we will achieve health equity. It's not just advancing, we will achieve it. It may not be in my lifetime, but I will do all I can to help us get there.
Yeah, no, you talk about that, sort of coordination and the collaboration. We have systems that are siloed. We heard earlier, how we can create better coordination and accountability across pieces. And it is a fundamental challenge that we have when, food is at USDA. You've got health sort of over here. You've got education over there, but that's not how people live their lives.
Exactly.
It is at the intersection of all of these issues. So you are in a room of funders. I do have to caveat, this is a non-solicitation film. But as you think about like what it takes for us in that partnership, so you've talked about public leaders in that space and others in community. Where do you see philanthropy partnering in achieving that vision?
Yeah, philanthropy is essential. And I say that as somebody, I had the privilege of spending time at Robert Wood Johnson Foundation before I joined faculty. I was in their research and evaluation team. And so I feel like I've learned a bit about philanthropy, and I took so much from that experience in my faculty role and learning about how do you truly partner? How do you think about impact? I just remember having such great opportunities to travel into communities where the foundation was investing and meeting with people and talking about impact on the ground. And how do we tell that story? That was part of my job, is what are the evaluation data we're collecting to help show impact? And when I think about that experience at the beginning of my career to where we are today, certainly philanthropy is such a critical partner. And it's not about being a funder. Like I really think about partnership. I think about our own partners who we work with. We have a great relationship with a number of partners, and it's really co-creating, where are we going next? How do we work together? And one of the things I'm thinking about is, how can we continue to encourage philanthropy to lean into those areas, especially where the federal government has pulled back? Like the areas that are so critical, I mentioned earlier, right? LGBTQIA+, health equity, structural racism. If the federal government's not funding those areas and we haven't solved the problems yet, are those opportunities to think together and to work together and to invest in solutions that are going to change people's lives. So that's my hope for people in this room. If you haven't connected and partnered yet, academia, we can co-create strategies and opportunities and answer those questions that can help inform future investments.
And I'm going to invite people to line up if you have a question you want to ask Dean Pollack Porter. And while we're doing that, data. I'm a data nerd, but also we need data to know where we are. And we've talked a little bit about the loss of data, particularly in some of those challenging areas. What we're seeing, CDC kind of cuts, PRIMS data on pregnancy and those areas. How should we be thinking about data, and how do we make sure we have those capabilities to know where we are and whether we are making progress on advancing equity or if we're backtracking in places?
Yeah, I am concerned about the losses in data in terms of even being able to monitor surveillance, things like measles, things like vaccines, other issues that are critically important. And I'll say one of the things is, are there opportunities to help fill the gap, whether through philanthropic partners or through just coalitions where we see people sharing data. It's interesting, I remember seeing some emails when I was chair of the Department of Health Policy and Management after data started being removed from websites. And people were like, well, actually, I have those data sets, let's share. And it's really been interesting, right? How to see people coming together in a way. And that was out on Blue Sky, on LinkedIn, people were saying, I have these data sets. Does anybody else have these? And seeing people come together across institutions in a way you had not seen before. It actually was very powerful. The other thing I'll just say too is I often remind, I'm a mixed methods person, so I also often remind people of the power of qualitative data. Mm-hmm. And sometimes if we don't have those quantitative data, can we get the stories from people? Can we use strategies like photo voice, use other strategies where community members are telling their story, collecting the data and sharing it? But it is something that I am concerned about and wondering how we're going. That's part of the building forward. We have to figure out that piece and have trusted and reliable data, right? And what happens if we have this period of time where there's no data at all in certain areas. What does that mean for the work we're doing to try to address some of these problems?
And it's
Yeah.
also a shift, you were mentioning earlier, shifting the system within academia in terms of what we value for impact,
Mhm.
in terms of determining tenure. But we are so, in some respects, ingrained on the data. And
Mhm.
so the notion of qualitative data has always been, in academia. So how do we also shift that culture to think about, community driven data or community collected data in a way that is on par with, you know, the massive survey and whatever we're looking at there.
Yeah, that's part. I so appreciate you lifting that up, and that's part of changing the system, right? It's how do we one name those methods, and I also think there's a role for academics to publish that stuff because that's how we know that certainly the peer review process, as flawed as it is part of the process, and so certainly getting information out into peer review journals and also just out broadly. Sharing white papers, sharing other outlets to get this information out, I think is also really, really critical as we're trying to normalize having data that are not quantitative, right? So thinking about other things, stories, even art. I mean, there's so many ways that people tell their stories, things that we can call data. And so I embrace a broader definition of that, and we have to normalize what is acceptable and not. The other thing I'll say is I think there's a real opportunity too for data literacy as well, and helping people understand the importance of collecting data and why. And I've seen opportunities where, or seen that grants and projects where community members are collecting the data themselves. I worked on a health impact assessment many years ago about a proposal to close some pools in Baltimore, and we partnered with young people who went out and collected the data for us about how the closing these pools in certain communities was going to impact them. It's powerful. Talk about giving power to people in community to collect the data that we collectively work together to share and to get out there. I mean, we need more of those types of efforts. And I think that's another opportunity for philanthropy where we're seeing more funding in community on ground versus funding somebody like me or my team, but really getting on ground and having academics walk alongside community members. Another way we can think about shifting power and giving power and agency to community members.
Well, great. What questions do you guys have for Dean Pollack Porter?
And if none, that's okay too. No.
There'll be questions.
Hi, Dean Pollack Porter, Kiana Thomas and Health Forward Foundation in the Kansas City region. Thank you for being here. Thank you for the space you occupy and how you lean into it. So you have a health and all policies orientation and leadership experience. Oftentimes in philanthropy, we work cross-sector. So we often find ourselves working with public health and with government. What are your suggestions on how to work with business, the chambers, the civic councils concerning the value of public health to the business bottom line? Because I think it's a missing piece that's essential in public health conversations.
Yes. And I know your next session has some representation there. And shout out Erica in the back. It's such a critical partner. This is a struggle. And I'll just give an example. One of we have at Johns Hopkins, there's something called Johns Hopkins Tech Ventures, and they focus a lot on taking innovations and bringing it to scale and to market. And one of my faculty, when I was chair of the Department of Health Policy and Management, created this app that was related to teen driving. For anybody who has a teen who's driving, you understand that there's value in sort of having some monitoring on that when your child's getting behind the wheel for the first time. And I remember he called me and said, I went to engage with this group about taking this to scale, and they weren't interested because they didn't see an ROI. They thought, well, we're not going to make money off of that thing. Is that really, is there a market? Are people going to actually pay for that? And then are we going to get investors in that? And so for me, we got to help them think differently about what is ROI, right? And I'm not an economist, but I have worked on social return on investment. And a lot of times that's way more powerful than the dollars. So to me, it's, how are we making an impact? How are we partner? We have to think business, private sector is critical partners, right? They are partners in this. And that's the first place. And then also it's how can we understand what levers are important to them that we can work together on. But this issue of the ROI has been something I've been really challenged by, where I've said, well, wait a second, maybe it's not going to make you a lot of money, but it's going to save lives. How do we value that?
Right.
And so we continue to have these conversations, but I appreciate your question because they are so critical. I'll just say one other thing about this too. A colleague of mine said to me that we need to do a better job of understanding the incentives.
Yep.
And how do we speak to that if we can? And so I think that's some opportunity for those of us in the health space to figure out there. And more engagement, I think, hopefully will help us get clarity on that.
I think it's a space health equity in particular needs to do a better job. What is that? We use moral assuasion, and it doesn't work. So let's try some other things and think about that. But becoming more bilingual in that language of what does business care about and how do we speak to that?
Yeah, Angie.
Hi, Angie McGowan from the American Public Health Association. Great to see you and congrats on your new role.
Thank you.
I love what you were saying about kind of reimagining what you were thinking about for faculty in terms of moving towards the impact. And I'm wondering in this time, as a lot of us are thinking about kind of where do we go next and how do we rebuild this health system we need, what are you hoping to get within the school for students? What are those new skills or new opportunities that you're trying to put in place so we can think about how students can be part of that coalition and moving to where we need to go in the future?
Yeah, thanks, Angie, for the question. One of the things I'm gonna answer this in two ways. I just on Monday was at a convening with the De Beaumont Foundation and with Hopkins around public health workforce, and they talked about the Public Health Wins survey that came out. If folks have seen that, it was of public health professionals of the workforce at the local, state, and federal levels. And it asked sort of the top skills people felt like they needed to be trained in. Number one, apparently I've heard this been like this for 10 years, was around budgeting and putting budgets together. But number two was policy engagement. Policy engagement. People acknowledge the importance of understanding policy, understanding the policy process, and how to engage. So I say all that to say at what we are focusing on, and one of the areas of expertise at the Bloomberg School is around policy and advocacy. We actually are proud that we had the first ever course in this country on public health advocacy, taught by Shelley Hearn, former executive director at TIFA, who created that course. And we are still teaching it today. And we have a number of other courses in public health advocacy that we are teaching. That is a skill for students to learn moving forward. Of course, also learning about things like AI is critically important for this area. Also learning how to listen. How do you engage with people who do not look like you, have similar lived experiences? And the importance of democracy and what that means for health and for public health. So I think these are areas where we are providing training in the classroom, but also spaces for people to just be in conversation. I continue to be challenged by some of our younger students who talk about just canceling people who they don't like to engage with. And I'm like, well, what is that going to do? Like, how are you going to achieve your goal by not talking or engaging with the person who has the power of the decision that you want? And so helping people understand how critically important it is to engage and to listen. So those are just other important skills I think people that we're leaning into now in public health. We always were, but more so now. Mm-hmm.
Hi, Dean Pollack Porter. I'm Julia McCarthy. I'm a senior program officer with the New York Health Foundation and actually a current fellow at the Bloomberg School. I'm getting my MPH. I will just side comment say, we've used some of the tools I got in an advocacy class and are thinking about embedding them into our application processes for any advocacy grant. So that's like one concrete, amazing takeaway. But I know that you had developed the judicial health notes, and I loved that project. And we've talked a lot about litigation this morning, and I'd love if you could just explain it to the room, please.
Yeah, thank you. Thanks. To help achieve health in all policies, I created a tool a few years back called the Legislative Health Note. So basically, it's a tool that does rapid analysis of bills coming out of non-health committees in particular to lift up the potential ways that that bill can impact health in a positive and negative way. So we then share the findings and usually at a bill hearing, we're not testifying in favor or against the bill. It's really about presenting the evidence. So part of the idea once was to sort of extend that and say, well, the courts make a lot of decisions. Courts, maybe people say don't do policy, but their decisions have implications for policy. And so we extended that tool and created something called a judicial health note. And what that tool does in particular is that we look at decisions being made by judges and how that decision will be implemented in the community. So for example, one of the judicial health notes we did was of the Supreme Court decision related to grants passed in Oregon around encampments, basically saying you can't have these encampments, right? So that decision was made in the courts. The Supreme Court upheld it, and basically after that, cities started to remove encampments of homeless individuals.
Yeah.
We did an analysis of that particular decision and pulled together all the evidence that shows actually encampments are not places that have a lot of violence, that show the challenges and the harm to people, the need for behavioral health services and treatment and all of these things. And we have really just pushed that out into the lay public. So writing op-eds, sharing these reports with partners on the ground. And anytime we see a city, anything in the local paper, we send our findings to the decision makers in that jurisdiction to say, before you do that thing, here's this report that we have and some data that we have. So I appreciate you asking about the judicial health nodes. We have funding from Bloomberg Philanthropies to help to support that. So we are doing these notes for people, training people on how to do it for when our funding ends. But right now we have a team that's just doing these analysis because we think it's the right thing to do.
It is the right thing. Thank you for doing that and for sharing.
Yeah.
We will be talking about litigation tomorrow as a tool and some of the litigation monitoring we're thinking about as well. Hello.
Hello. Thanks so much, Melissa Stafford-Jones of the Public Health Institute. Kara, thanks for asking such great questions. And Dean, thank you for all of the thoughtful responses. I wanted to just express appreciation for your comments around trust. We are working on that. We've launched a dialogue project that's really trying to engage at the local level in communities across the fullness of communities and their very diverse points of view in the trust spectrum, as well as local public health. And I wanted to ask you two things. One is, we are also thinking a lot about both how you build trust with communities, but how we build trustworthiness in our public health systems. And a piece of that, you also mentioned this, is maybe some of the ways we need to evolve our thinking about how science and evidence interrelate with communities' experience. And I was just wondering if you could share any thoughts around that.
Yeah, I love the work that you're doing in dialogue with communities. So thank you for that. You know, one of the things that I think is part of the building forward is asking who are trusted messengers, right? It's not me. I'm a person who is an academic, considered by some to be an elitist when I go into communities. And so people aren't gonna, at one point, I do think people listened to the trusted folks like me, the academics in the room. And that's just not where we are now. People are consuming information differently. People are listening to people who I was talking to somebody the other day that, and we follow all the data on this, is, you know, people aren't even listening to podcasts anymore. They're like too long. They're listening to summary videos of the podcast. And so if you make a 2-minute video of a 15-minute podcast episode, and that 2-minute video is not accurate, that is what I'm learning about that topic, because I'm not going to the 15-minute podcast to listen to that.
Yep.
And so acknowledging how people are consuming information and where they're finding the sources of things that they trust. One of the things I've been asking and talking about with our team is, well, how do we actually connect with those people who are trusted voices in community to, again, I would love to influence how they think, but to engage and to understand, and really showing up to build those relationships. And this is really important too for folks in research like me. And this is actually, I celebrate philanthropy because I've had government funding, I've had philanthropic funding, and the latter is always more flexible for me anyway. And one of the things I remember is I had a grant from the Robert Wood Johnson Foundation with some colleagues, and we implemented something in rural communities called Play Streets. It's intervention in urban communities, and basically we were promoting creation of safe places for kids in rural areas. That grant was created where we had time up front to build partnerships with community. And so we worked in 4 communities around the country, including Choctaw Nation in Oklahoma. And if anybody's connected with tribes, you know you have to spend a lot of time building trust in those relationships. And I remember flying to Oklahoma City, driving the 3.5 hours to the tribe to meet at tribal council, and then waited there for 2 hours, and they said, sorry, we can't get to you today. We'll see you next month. Come back again, you do that next month. The 3rd month I got heard. But all of that was showing up and being present. it is hard to have that time covered on a federal grant. And I would say, like, this is something that philanthropic partners have really allowed us to have that time and space to be in community and to build those relationships. And I think about, even we worked with the church in North Carolina, it was the same thing, flying down there, talking to the church leaders, showing up. And I even remember when the project was over, I was so sad. The pastor said, "You're still coming back." Of course I'm still coming back. And part of it was, yes, I had funding to support my time to keep coming back. We were able to build in the dissemination into the timeline. That also doesn't happen in some funding, particularly from federal grants. And so I think all of that helps to build trust, helps to support me as a trustworthy voice in relationship and partnership. And I'll just say, finally, it's approaching those relationships with humility, that people in the community are the experts. They have the lived experiences. When I come to present some findings, those are findings that may not resonate with the community. And we have to do a better job of listening to what people's experiences are and how they drive with what some quantitative analysis might have illuminated for us.
Yeah. Okay. Quick questions. We're going to do two quickly.
Hi, David Bevavino from the Funders Forum on Accountable Health, the GW. My question is about kind of your role within the higher education ecosystem and its connection into public health. So obviously you're at sort of the pinnacle of research university, but I'm curious how you think about partnerships with other sectors of higher education in building a public health workforce and also getting into communities. My background's in higher ed research and consulting, and I worked a lot with community colleges, but almost never heard about public health at that level. They're doing a lot in allied health, but not necessarily public health as we would talk about it. So I'm curious how you think about partnerships with other sectors and what role you see them playing in especially rebuilding the trust in public health.
Yeah, thanks for the question. I would just say absolutely critical partners, and thinking about various types of institutions, whether it's community colleges, HBCUs, MSIs, like all of these, those acronyms I shouldn't be using, but we're using them.
The jargon,
all of the things, right? Like, I think that they're critical partners. And I absolutely agree with you. And I would even say earlier, I remember one of the highlights of my career was going to talk to some 8th grade girls at Mother Seton Academy in Baltimore about public health. And like that, and they invited me to come in as like a careers forum. And I mean, these girls were like I'm like, do you know what public health is? And they're like, no, what's that? Right. So how are we partnering with younger people, K through 12, to help them understand and think about public health, and really taking advantage of those opportunities and partnering with trade schools? I think we saw that during COVID, right, where there were a lot of partnerships to help in terms of contact tracers, for example, tapping into different sectors. I think we should remind ourselves what we learned from the pandemic and to think through how we can implement that and extend it now to help to address some of these gaps and build partnerships.
Hi there. Gabrielle Galusha, Association of Maternal and Child Health Programs. I have my master's from Boston University, and I'm very proud to have gone there. And I was curious what Hopkins and other public health schools are doing to advocate for the cut of federal funding, specifically through what's the competitive grant process known as the Special Projects of Regional and National Significance. John Hopkins actually received over $3.5 million through that over the last couple of years. And it's proposed to be cut by nearly $50 million on the House bill. And so I was wondering if public health schools are coming together to advocate for federal cuts, or specifically that program in itself.
Yeah, thanks for the question. There are certainly some efforts to come together on certain areas. So the Association for Schools and Programs of Public Health, or ASPPH, has named a platform that have a number of things that they're advocating for. Right now, it is around, I think the thing that's most prominent is around the designation of public health and nursing and not being eligible for the Grad Plus loans, et cetera. I have not heard about this issue from ASPPH. What I will say is around Hopkins, we are very blessed to have a strong federal strategies team that I engage with regularly, particularly for my interest in policy and advocacy, and partner with them and do visits. And we have identified a number of priorities, including some of the cuts. I know you talked a lot about Medicaid yesterday, even Medicaid's on the list, cuts to SNAP. I mean, these are things, and part of what my job to do is as dean is getting our faculty out there to connect with policymakers who are able to talk about the work they've been doing in these areas. So we have a whole Department of Population, Family, and Reproductive Health that's been doing a lot of work in reproductive health, MCH, maternal child health, that are meeting with policymakers. We've had several Hopkins on the Hill Day where we bring people and talk about their research impacts, and we advocate. I'm not a paid or registered lobbyist, but the lobbyists can ask for those things. But for me, I can tell the stories of the impacts of these programs. So I would say, yes, we have a long list of things that we're advocating for in this moment. But I haven't seen ASPPH as a body embrace this particular effort and these cuts in this particular program.
So if I did a real quick follow-up on that, because one of the things that we've talked about is, we all have to work a little differently in this moment because these are different times. We've seen, some universities coming together. Philanthropy is trying to come together. How is public health and the universities, the public health schools coming together?
Yeah, I think we're coming together in a few ways. One is through, there's a hierarchy too. So all schools of public health are within a broader university. So I just want to name that. And so several of the research institutions are part of the AAU, which is a consortium representing research institutions, and they are doing a lot of advocacy and lobbying. There have actually been some of the lawsuits that have come out against the indirect cuts or grant cuts have been led by higher ed, really using the law as a tool. I will say that I think there's more that we could be doing together. ASPPH, the governing body, pulls together all of the leaders monthly for calls, for community building, to be together. I have my own dean's group with a handful of deans, and we regularly meet to share and commiserate and just lift each other up. But I do think we can be doing more of coming together. And I understand we're all in different states, different politics, but certainly asking ourselves, where can we come together? Where is there alignment? And people say, well, aren't you competing against each other? Absolutely. And we all care about the same thing. So this is a real opportunity for us to come together in a new way.
So last question is, leaving in hope. You're choosing hope. What is giving you hope in this moment?
I would say two things. I love that we're in this room and having this conversation. So thank you. Thank you all for making time to talk about these issues. This gives me hope. And then the young people. Oh my gosh. Talking about, when I consider myself a young person, but my nephews tell me I'm not young. So when I'm talking about the people younger than me, I really look at them. They're the future. And I'm so excited for students that are choosing public health now, that are being trained in public health, that see an opportunity to continue to make a difference. And I just feel so incredibly, incredibly hopeful when I talk with them. I feel just better about the world when I see their energy and their hope and their determination. And I know that we have a great generation of leaders that are being trained and are coming up after us.
Keshia Pollack Porter, the 12th Dean of the Johns Hopkins University School of Public Health, second woman dean, and the first Black dean. Thank you so much.
Thank you.
Yeah. I hope you will join us to continue the conversation in June.
Thank you.
Good luck.
Yes, we look forward to welcoming you to Baltimore. Thank you so much.